Welcome to the deep dive. Navigating healthcare. It's one of those topics that can feel pretty overwhelming, right?
Oh, definitely.
There's the personal side, like how are you actually going to pay for things, and then the whole system side, how do you know the care you're getting is, well, good quality.
Absolutely. It's this really crucial intersection, your financial protection on one hand and the standards of the places providing care on the other. You kind of need both pieces to feel truly informed.
And that's exactly what we're diving into today. We've pulled together a stack of sources for this deep dive. Got articles, info on healthcare coverage, specifically in India, and details about the organizations setting quality standards, both, nationally and globally.
Right. And our mission here is to really unpack these sources, pull out the most important nuggets, you could say.
Yeah.
We want to give you a clearer picture of, let's call it your financial shield against healthcare costs.
Yeah.
And also help you appreciate the quality systems hospitals are aiming for.
Think of it as getting a shortcut. Understanding your health plan and the benchmarks for quality care that providers are, well, shooting for. So let's jump right in.
Let's do it.
Okay, let's start with that really essential first layer. Healthcare coverage, focusing on how it looks here in India. We all know medical bills can escalate incredibly fast.
They really can.
Whether it's a clinic visit that gets complicated or something major like surgery, having coverage helps, obviously. But one of our sources put it so well it really stuck with me. Having insurance doesn't guarantee peace of mind understanding it does.
That line really hits home, doesn't it? Because at its core, healthcare coverage in India, it's about financial protection.
Yeah.
The sources point to a few major ways this happens.
Okay, so beyond just knowing you have coverage, what are the main structures? How does it work?
Well, one big path is through government schemes. These are publicly funded. A major example is Ayushman Bharat, PMJA. This gives free coverage up to 5 lakh per family per year. It's aimed at lower income families based on specific 2011 data and covers things like hospital stays, surgeries, diagnostics.
And you can use that where?
At impaneled hospitals, both public and, importantly, some private ones too.
That sounds like a pretty significant safety net for those who qualify. Are there, state-level variations too?
Yes, definitely. State schemes also exist. They vary quite a bit, state by state, but they generally focus on secondary and tertiary care, sort of the more complex stuff.
How would someone know if they're linked to one?
A good first step is often just checking your ID card or ration card. Sometimes the linkage details are right there.
Got it. So that's the government side. What about private options?
So the private sector offers private health insurance. These are the plans you typically buy yourself, right?
Oh.
Either an individual plan or maybe a family floater plan.
Okay.
You pay an annual premium for what's called a sum insured. That's the maximum the policy pays out in a year, maybe 5 lakh, 10 lakh, something like that.
And what do they usually cover?
Typically, hospital admission, surgery costs, certain daycare procedures, also pre-hospitalization costs like tests beforehand, and post-hospitalization care, usually for a set period like 60 or 90 days after discharge.
And with private insurance, you always hear about the fine print, right?
Right.
Exclusions.
Oh, absolutely. That's critical. Exclusions and waiting periods are standard. Things like cosmetic surgery, routine dental work, injuries from substance abuse, those are usually out.
Okay.
And importantly, if you have a pre-existing condition, there's almost always a waiting period. Could be 1 year, could be up to 4 years before the policy covers treatment for that specific condition.
That's a really key detail. Easy to miss. What about coverage through your job?
Right. That's the employer-provide group plans, often part of your benefits package. These usually work on a cashless basis within a network of hospitals. So the insurer settles the bill directly. They often cover family members too.
What's the upside there?
Well, premiums can be lower than buying individually. The big downside, though, is the coverage is tied to your job. You leave the job, the coverage typically ends.
Okay, that clarifies the main types. Now, you mentioned cashless. You also hear about reimbursement. How do those actually work when you need to, use the insurance?
Yeah, that's a critical distinction in how you access the benefit. With cashless, if you go to a hospital that's in your insurer's network.
Okay, the network is key.
Exactly. The hospital and the insurance company sort out the bill directly. You generally don't pay the main bill up front, maybe just for things not covered or if there's a copay.
So less immediate out-of-pocket stress, but you're limited to that list of network hospitals.
Precisely. Reimbursement is the other way. You pay the hospital bill yourself first. out of your own pocket.
Right.
Then you gather all the paperwork, the bills, the reports, prescriptions, discharge summary, everything, and submit a claim to your insurer to get paid back for the covered costs.
And you'd use that if you go out of network, maybe.
Yeah, typically if you choose a hospital outside the network, or sometimes even in-network, if cashless approval doesn't come through for some reason.
Yeah.
It involves more upfront payment and paperwork from your side.
That makes sense. And, well, whether it's cashless or reimbursement, it only helps if the actual treatment is covered, right?
Exactly.
Which brings us perfectly to understanding what's actually in, and maybe even more importantly, what's out of your coverage. Knowing the details here seems absolutely crucial.
It truly is. So based on the sources, let's look at what's typically covered by health insurance plans in India. This usually includes stuff like hospital room rent and nursing charges,
Okay.
ICU stay costs, the surgery itself and related procedure costs, doctor consultation fees while you're admitted.
So not regular visits outside the hospital.
Generally, no, just during admission. Also, diagnostic tests, though sometimes there are limits or sublimits. Ambulance charges, again, usually up to a certain amount. And daycare procedures.
What are those exactly?
Daycare procedures. Those are treatments that need less than 24 hours in the hospital, thanks to medical advances. Things like cataract surgery or maybe a session of chemotherapy.
Got it. That covers a lot of the big ticket items for hospitalization. What about the things that are frequently not covered? This feels like where the surprises often pop up.
They certainly can. So typical exclusions often include OPD visits, those regular doctor consultations when you're not admitted.
Right.
As we mentioned, pre-existing conditions, at least for that initial waiting period, cosmetic treatments or purely dental stuff, unless it's due to an accident, maybe.
Okay.
Also, things classified as non-medical items, gloves, masks, sometimes admission kits, toiletries, stuff like that.
The consumables.
Exactly. And unfortunately, injuries that result from substance abuse or intentional self-harm are usually excluded too.
That list really drives home why you need to actually read your policy document. It's not just red tape. It's about avoiding nasty shocks later. Like one source said, always read your policy's exclusions and waiting periods.
Precisely. And, the sources offer some really practical pro tips. Think of these as key questions you should ask yourself or actions to take about your coverage.
Okay, let's walk through those. Maybe frame them like, if you're looking at your policy, here's what you should be asking.
Perfect. So first, review your policy thoroughly. Don't just glance at the summary. Ask yourself, what specific things are listed as covered? What are the explicit exclusions? Are there limits on hospitals that network? Any waiting periods I absolutely need to know about.
Right. Get the lay of the land before you actually need to navigate it. What's next?
If you know you need a specific treatment or procedure, ask about specific coverage. Don't assume. Will the plan cover the main procedure itself? What about related costs, anesthesia, post-op care, maybe rehab? What about the diagnostic tests leading up to it, like MRIs or CT scans? Verify each major component.
Good point. And understand your own share of the costs.
Yes, understand your costs. Get clear on what's your copay, that fixed amount you pay for certain services. What's your deductible? That's the amount you pay first, out of pocket, before the insurance starts paying anything. And is there an out-of-pocket maximum, the absolute most you'd have to pay for covered services in a policy year? Knowing these numbers is vital for budgeting.
What if you need a specialist? Is that handled differently?
Good question. Clarify specialist care coverage. Do you need a referral from your primary doctor first for the insurance to cover it? Are the copays different for specialists versus general practitioners? Check the rules.
And what about staying healthy? Preventive care.
Definitely check for preventive care coverage. Things like annual checkups, vaccinations, certain health screenings, they're often covered, sometimes fully or with a small copay. Insurers actually like this because they can catch problems early.
Makes sense. And emergencies. That's when you really need it to work smoothly.
Absolutely crucial. Verify emergency care coverage. Which hospitals count as in-network for emergencies? Are ambulance costs covered? Are there limits on distance or amount? You don't want surprises then.
And finally, what are the big don'ts that the sources flagged?
The key don'ts are pretty straightforward but important. Don't assume all hospitals are in your network. Always check, especially for planned procedures. Going out of network can cost you a lot more or mean you only get reimbursement.
Right.
And the other big one, don't forget about those exclusions and waiting periods we talked about. Keep them top of mind.
That is incredibly practical. It really sounds like doing a bit of homework up front can save a massive amount of stress and unexpected expense when you're already dealing with a health issue.
It really can.
Sure.
Knowledge is power here.
Okay, so we spent some good time digging into your personal financial your health coverage. Now, let's pivot a bit. Look at the other side of the coin, the quality of the care itself. How do you know if a hospital or clinic is actually committed to providing safe, high-quality treatment? This is where accreditation comes in.
Exactly. Think of accreditation as a formal process. Healthcare organizations basically volunteer to be evaluated against specific, demanding standards for quality and patient safety. In India, the main national body for this is the National Accreditation Board for Hospitals and Healthcare Providers, or NABH.
NABH, and that's connected to the government's Quality Council.
Yes, precisely. NABH is a constituent board of the Quality Council of India. It was set up specifically to establish these benchmarks and run accreditation programs for healthcare organizations across India, really aiming to lift the standards across the board.
Okay, so that's the national benchmark. And on the global stage, there's another big name mentioned.
That's Joint Commission International, or JCI. JCI is really seen worldwide as a leader in setting the bar for healthcare quality and patient safety. They operate in, I think the sources said, over 70 countries, so their standards are very widely recognized.
Wow, 70 countries. So what's their core mission? What are they trying to achieve with this global reach?
JCI states its mission as to enable and affirm the highest standards of healthcare quality and patient safety for all.
And how do they actually do that? What do their standards involve?
They develop these really rigorous international standards. These aren't just suggestions. They form a framework for evaluating how a healthcare organization performs. It helps them measure, assess, and crucially, improve their performance continuously.
So it's about improvement, not just passing a test.
Exactly. And a key part of their framework is the International Patient Safety Goals. These focus on specific areas that are known trouble spots in patient care globally. Things like preventing medication errors, reducing infections, ensuring correct surgery on the correct patient.
That sounds incredibly thorough. What else does JCI offer besides just accrediting hospitals?
Well, beyond their main accreditation programs, which cover hospitals, clinics, labs, even newer areas like telehealth and sustainability in healthcare, JCI also offers advisory services. They guide organizations on the journey to improvement. Plus, they have educational resources and publications to share best practices widely.
Now, our sources mention some benefits that hospitals themselves see from going through this pretty intensive accreditation process based on testimonials. What were some of the key takeaways there? Why do they do it?
Yeah, the benefits highlighted are quite significant. It's not just about getting a badge. Testimonials pointed to things like excellent training outcomes for staff. Really importantly, they reported much better teamwork, coordination, and communication between different departments and shifts.
Which you can imagine directly impacts patient experience and safety.
Absolutely. For the hospital itself, it gives them a competitive edge, boosts community confidence. It also really helps them improve their risk management, organize their patient safety efforts more effectively, and build a genuine, deep-seated culture focused on patient safety.
So it's transformative internally.
It seems so. They also mentioned it adds value to the organization and, critically, enhances patient confidence because it shows this ongoing commitment to meeting the highest international standards.
That paints a picture of something much deeper than just external validation. It sounds like it drives real change in how care happens.
That's definitely the goal. And JCI's vision, it's quite ambitious. A future of zero harm and highly reliable care delivery.
Okay, let's widen the lens now. Look at the overall healthcare landscape in India. Our sources describe it as, well, complex and definitely evolving.
It certainly is complex. India's healthcare system is this mix of government initiatives, a very large and active private sector, and now, increasingly, digital technology weaving through it all. There's been real progress, no doubt, but significant challenges definitely persist.
Where are we seeing the main areas of progress?
Well, on the government side, initiatives like Ayushman Bharat PMJAY have really expanded the reach of coverage for many, many families. There is the overarching national health policy providing direction, and a huge push is happening with digital transformation. The Ayushman Bharat Digital Mission aims to create this integrated digital health infrastructure for the whole country.
And specific digital tools.
Yeah, things like Cohen for vaccine management, e-Sanjivani for telemedicine consultations, e-hospital systems in government facilities. These are all making healthcare more accessible and delivery more efficient in many ways. The sources even noted a recent budget item exempting customs duty on 36 life-saving drugs to make them more affordable.
So, government action on access, digital, and affordability. What about the private sector's role in this progress?
The private sector is massive in India's healthcare. It's particularly dominant in cities, providing a lot of the secondary, tertiary, and even quaternary, the super specialized care. Private insurance and employer plans, as we discussed, are key coverage routes for a large segment of the population. Plus, the private sector drives things like medical tourism and R&D.
Okay, so lots of activity and progress. But what about the hurdles? The challenges that still need tackling in India's healthcare system?
The sources pointed out several major challenges. A big one is the coverage gap. Despite progress, a significant chunk of healthcare spending, around 26% the sources said, is still paid directly out of pocket by individuals.
Which can be catastrophic for families.
Absolutely. Then there's the urban-rural divide. Big disparities exist in access to quality care, good infrastructure, and enough skilled doctors and nurses between cities and rural areas. Coverage levels are also often lower among certain marginalized groups. And the system continues to battle major public health issues, both infectious diseases and the growing burden of lifestyle diseases like diabetes and heart conditions.
Those are definitely significant system-wide challenges. Based on the sources, what are the key areas identified for improvement moving forward?
The main focus areas that emerged are continuing to expand insurance coverage, really trying to reduce that out-of-pocket burden, strengthening rural health care, improving infrastructure, primary care access, getting more health workers out there, addressing social and religious disparities through targeted programs, and definitely continuing to invest in digital health technologies to improve efficiency, access, and data management.
And navigating all this complexity, this evolving landscape, that's where other services come in, right? Like consultancies helping hospitals.
Exactly. Yeah. The sources mentioned consultancy services, like SupremeDic, for example, exist precisely to help hospitals navigate this environment. They assist with things like strategic planning, improving operations, and even achieving those accreditations like NABH that we talked about. It just shows how complex it is for providers too.
Okay, let's try and bring all these different threads together now. We've taken a really close look at your personal health coverage, how it works, what's typically covered, what's often not covered, and those really crucial tips for understanding and using it effectively.
And then we explored the systems that hospitals and healthcare providers use to try and ensure quality and safety, looking at accreditation bodies like India's NABH and the global player, JCI.
Right. And understanding both sides of this equation, your coverage and the provider's quality standards, that's what really empowers you as someone using the healthcare system.
It really is. It's about knowing where you stand financially when you need care, and also having some confidence in the standards of the places you go to for that care.
This has been a genuinely insightful deep dive, I think, into a topic that really affects everyone. We've gone from the nitty-gritty of your policy exclusions to the high-level standards hospitals are striving for internationally.
It definitely shows you the many, many layers involved in just getting access to and receiving good quality care.
It really does. And it leaves us with a pretty interesting thought to ponder, doesn't it? How do these increasing quality standards, driven by bodies like JCI and NABH, combine with the ongoing expansion of coverage schemes like Ayushman Bharat? How does that combination fundamentally change the expectations you should now have, not just for accessing healthcare, but for its actual safety and quality here in India?
That's a powerful question. It points to maybe an evolving social contract around healthcare.
Definitely something to think about. And we really encourage you, after listening, maybe take a practical step. Pull out your own health insurance documents, use some of those pro tips we discussed, really try to understand your specific plan better. And maybe do a quick search online. See if the hospitals you use or might use are accredited. Look for that NABH or JCI certification. It's often displayed on their websites.
Being an active, informed participant in your own healthcare journey really does make a huge difference.
Absolutely. Well, we hope this deep dive has been valuable for you. Thank you so much for joining us.
Thank you.
And we look forward to the next deep dive.